So the first question I want to ask Professor Lee. Modern medicine has become increasingly specialized. Cardiologists treat the heart, neurologists treat the brain, and vascular surgeons treat the great vessels. Was there a moment when you realized the limitations of this fragmented approach, and what was the turning point that led you to shift from single organ care to whole vessel management?
Thank you. It's an excellent question. But before I start, I would like to ask our colleagues, have you ever read one famous Chinese novel, The Legendary of Three Kingdoms? Yeah. On the opening, there is an idiom. The world, when long divided, must go to reunite. Mm-hmm. And when long unite, it goes to redivided. Mm-hmm. It's like, just like science. Mm-hmm. We start from no, because when we start, we know nothing. We just say it's a body, it's a man, it's a woman, it's something like that. Later, when we know it more detail, we know, okay, he has eye, he has heart, he has lung, he has blah, blah, organs. And then we study the patient. Mm-hmm. And we study what the heart is working, what the blood vessel is working, what the brain is working. And when we know the detail, then we find that all these separate parts are not really separate. It's united in a whole body. Mm-hmm. So it's time to reunite to treat the whole body. I think it's quite a time. It's very mismatch the development of every science. Mm-hmm. Because in the old time, for the physics, they know the sun rise, the moon rise, and the sun goes down, the sun goes down. Later, they know four kinds of force: the gravity, the strong force, the weak force, and the electronic force. And I know the physics try to unite all the four basic force in one united force. Mm-hmm. That's our people, our physicians should do. When I was in Australia, has my interventional training, my boss, very famous, very wise old man, he tells, although you are interventional cardiologist, mm-hmm. you didn't treat the patient. Mm-hmm. You are not the painter. You treat ischemia. You treat the patient's heart. What you focus is not only make the blood vessel looks better. Mm-hmm. You should make the patient feel better, live longer. Mm-hmm. That's my boss give me the suggestion. So I want to send this message to our colleagues. We should treat the patient, not only the brain, not only the heart, but the whole body.
Well said.
Thank you.
And thank Dr. Lee's sharing. And that's true. There's also Chinese saying that reunion will be get after long division. And so what's the thoughts in America? So Professor Cook, back in 1990s, you told me you and Professor Victor Zhao wrote that the era of vascular medicine has arrived. Mm-hmm. And looking back after 30 years, why were you convinced that vascular health deserves an independent medical perspective? What medical philosophy underpinned this vision?
Oh, thank you for that question. But before I dwell on the past, let me say something about the present. Thank you for having me on the show, Professor Wu, on the quest for truth, which we're all engaged in, the quest for truth, to try to reach the truth and make our patients' lives better. Yeah. So you asked me about the article that Victor Zhao and I wrote many years ago, 30 years ago. The time for vascular medicine has arrived. That was the title. And our thesis was that vascular medicine is something that we require all of the specialists. We require the endocrinologists who are treating diabetes. We require the rheumatologists mm-hmm. who are treating vasculitides. We require the vascular surgeons. We require the cardiologists to work together to take care of our patients, because vascular disease is a very common problem, mm-hmm. and some vascular circulations are overlooked. I take care of patients with peripheral arterial disease, and one of the things that I teach my trainees is that one must, when you see a patient with peripheral arterial disease, you have to also consider the coronary arteries and the carotid arteries and the aorta, possibility for aneurysm. popliteal aneurysm. So you need to think about the entire circulation. And if you think about the entire circulation, of course, you're thinking about the entire body. You think about that entire patient, as you were urging us to do. I will say one thing, though. I do have a great empathy for our colleagues, because in the press of the day, when you're seeing tens, dozens of patients, it's hard to remember this. You kind of focus on one problem for one patient. So it's difficult, but you give the best care if you can think of the whole patient, as you suggested.
Yes.
Yeah, thank you, Dr. Professor.
你好，中国，东方问道。